You are dispatched to a 19-year-old male that fell through a glass door and has a laceration on his left arm.
Okay. PPE, scene safety. This is going to be my only patient. The mechanism of injury would be the glass door, and he has a laceration on his left arm. I'm going to call additional ALS ambulance, and then I'm going to ask the patient if his neck is hurting, see if there's any pain, and if not, I'm going to rule out the need for C-spine since he doesn't feel any pain. And then I'm going to and then I'm going to move on to my general impression. Hey, I'm Aaron. I'll be an EMT. What seems to be the problem? The patient tells me that he fell through a glass door again, and he has bleeding on his left arm. So I'm gonna apply direct pressure to that, and then since he talked to me clearly, I'm gonna give him an A on the AFU scale, and since he has an open and patent airway. And so then after that, I'm gonna move on to my airway. Like I said, his airway is open and patent, and there's nothing compromising or obstructing it. And then I'm gonna move on to breathing, making sure his lungs are his chest rise and fall are equal and bilateral, and listening to lung sounds, making sure there's nothing abnormal. And then I'm also gonna initiate oxygen therapy via non-rebreather mask at 15 liters per minute of high flow O2. And then I'm going to move on to circulation, checking his pulses, and then his skin signs. What are his skin signs?
Skin is cool, pale, and dry.
Okay, and then I'm going to assess any major bleeding, which I already did by applying pressure to his left arm. And then I'm going to initiate shock therapy by simply just putting a blanket over him and conserving body heat. And then I'm going to make him a priority patient. And then after that, I'm going to attempt to take my vital signs, which would be his blood pressure. What's his blood pressure?
104/60.
And his respiratory rate?
24.
And then his pulses?
120.
Okay. And then I'm going to attempt to obtain a sample history. Are you allergic to anything, sir?
Just penicillin.
Okay. Are you on any medications right now?
I'm also taking blood thinners.
Blood thinners? Okay. Do you go to the doctor for anything?
Not really.
No? What was the last thing you ate?
I had some oranges.
Okay. And then events leading to it, you said you fell through a glass door and you cut your arm?
Yeah, I tripped.
Okay, got it. And after that, I'm gonna move on to my secondary assessment, which would be first palpating the scalp, looking for any DCAT BTLS, which would be deformities, contusions, abrasions, punctures, burns, lacerations, and tenderness and swelling, actually. Palpating the scalp, looking for any orbital fractures as well, making sure the pupils aren't dilated or constricted, palpating the back of the cervical spine, and then looking for any JVD or tracheal deviation on the neck. And then I'm gonna move on to the chest, making sure it's open and exposed, listening for any lung sounds and palpating it as well. And then I'm gonna move on to the abdomen and pelvis. Palpating the abdomen as well, making sure there's any visible signs of trauma, and then moving on to the pelvis, pushing down on it and moving it, making sure I don't feel anything or see any visible signs of trauma. And then I'm gonna move back up to the upper extremities, keeping in mind that he has a laceration on his left arm. I'm gonna check the pulses, and then I'm gonna move on. I'm gonna check to see if there's any fractures or visible signs of traumas on the arms. And then I'm gonna check his sensory and motor skills, seeing if he could feel what finger I'm touching, or and seeing if they could push down or pull up. And then I'm gonna move on to the lower extremities, checking the same thing, making sure there's no fractures or any visible signs of trauma. And then I'm gonna check the pulses as well. And then I'm gonna see if they could push down or pull up on both. And then I'm gonna assess any secondary injuries. And as well, I'm gonna roll them over if I can. I'm gonna palpate the cervical spine, and then check the buttocks as well, if I can, and palpate it. No visible signs of trauma. And then I'm assess any secondary injuries as well if there are any. And then to reassess this patient, I'm gonna reassess them every 5 minutes and get them out of here now.